Hi everyone, today we are at HRC Fertility in Beverly Hills and I'm excited to sit down with Dr. Katherine VanHise. Thank you so much for having me here today.
Thank you for being here. Hi everyone.
And before we jump into everything fertility, IVF, and movement, could you just tell us a little bit about yourself and the work you do here at HRC?
Absolutely. So hi, Katherine VanHise. I am a OB-GYN and a reproductive endocrinologist and fertility specialist. So that means I see patients that are trying to conceive, that want to preserve their fertility for the future, whether that be banking eggs, banking embryos.
Okay, perfect. So one of the questions we hear all the time, women going through IVF, is how should I be moving my body? There is very little guidance out there when it comes to exercise during IVF, IUI. So I would love to go through each phases of treatment and hear your recommendation.
Absolutely.
So let's start before treatment even begins. How do you advise your patients and how does that change once stimulation begins?
Great question. A lot of my patients come to me and are very avid exercisers or have their particular movement of choice already. If you're already doing something, I say continue with it absolutely until we start treatment. If you're not already doing something, that's totally fine. But I do encourage you to move your body with mindfulness and intention at least every day, whether that's just going on a nice walk after dinner, good for your blood sugar, but just good for your, I think, overall well-being in preparation for treatment. So I am a proponent of movement, exercise, all of those things ahead of time. I speak with all my patients when we first start the process and say, you know, there's a lot of different varieties of thought on this, but I'm a firm believer that you should keep moving your body throughout treatment. And when we first start, for the first few days, I'm actually okay with you continuing your regular routine.
Okay, so what's the cutoff? So the stimulation is usually 10 days?
10 to 12 days on average. So like 2 weeks where we're seeing each other every 2 to 3 days.
Okay.
Yeah.
And then when is the turning point when you say like the intensity should be less now? They can still moving, but like maybe, you know, skip the high intensity workout.
It kind of varies per individual, but on average, I would say after like the 4th or 5th day of doing your injections, your ovaries are going to start getting a lot bigger. And so I'm not telling you to stop exercising because I don't want you to exercise for no good reason. It's that your ovaries are getting larger. So like a regular ovary could be about the size of your thumb. As your ovaries are growing from all of the medication, they can get as large as your fist. And as they get bigger, I don't want them to twist on themselves because that will twist off the blood supply and it's a surgical emergency. We call it ovarian torsion. So usually on day 4 or 5, the ovary is getting large enough that you're probably going to start feeling bloated, maybe a little bit of heaviness or fullness in your pelvis. And that's when I say, please keep walking, please keep moving, but don't do any inversions, any twisting. So for my ladies who love Pilates, yoga, none of that. No high intensity jumping, horseback riding. I think of all the crazy things people have asked me. Zip lining, just because I don't want your ovaries flipping on themselves in the pelvis. But walking on a treadmill, always encouraged. If you want to get some cardio in, put the treadmill on an incline. So that's what I tell my patients, usually about day 4 or 5.
Okay. Yeah, so you sort of answered the next question, which was about ovarian torsion, hyperstimulation. Because there is tremendous fear around that. But really, how common is this complication?
Yeah, I mean, I'm looking for wood. Knock on wood, I've never seen it in the context of IVF or actually have ever even heard of it from a colleague that it's happened to one of our patients. I think, though, there is a reason as to why we are advising patients not to do exercise that puts them at risk for it, because it is really serious. It requires emergency surgery where you would need anesthesia. They go into your belly, find the ovary, and untwist it. So that's a big deal. It's not just something that can be managed in the office. But, you know, I've never heard of it, so I would say way under 1% of patients, way under that would have that torsion.
So keep moving, but be a little bit more mindful after day 6 all the way up to Retrieval. So here comes the next question, because we hear this again all the time. Should I be doing any type of movement on the day of egg retrieval? Or not any type of movement, but should I do any mindful movement, pelvic focus movement
Yeah.
before I head out for the procedure? Or less is more? Like, I don't know.
I kind of feel like less is more. There's a lot going on in the morning. Most of our egg retrievals are scheduled for the morning.
Okay.
So, we ask you to get here at least an hour before your procedure. So there's a lot of moving parts. I don't want to add more stress or create more tasks before you arrive here. I think, mindfulness, mindful breathing, you can even do that while you're waiting on your little stretcher in the pre-op area. But I wouldn't do anything crazy, because on that day, your pelvis is going to go through a lot.
Yeah. And your ovaries already like the size of a balloon.
Yeah.
Okay, so good to know. Focus on meditation and breath work.
Yep.
Now, what's the recovery window after retrieval?
Oh, this I get asked all the time. When can I go back to working out? That also varies a little bit. So for patients that have a really lot of follicles or had a really robust response to stimulation, it can sometimes take a lot longer for those ovaries to get much smaller. So I generally like to see my patients within 3 to 5 days after their procedure, get a baseline of how are your ovaries doing. Do you still have what we call free fluid, which is just normal sort of fluid after the procedure in the pelvis? And then I give more individualized guidance from there. But day after procedure, I always tell my patients, please go for a walk. It will help with your recovery. And then from there, kind of a little bit more individualized for when you can get back to full high intensity.
Now, does it matter whether you taken 2 eggs versus 20?
Yeah.
Okay.
I do think it does. So in a regular menstrual cycle, you grow and ovulate one egg or one follicle. So if you only have 2 eggs or follicles that were growing during IVF, that's basically pretty similar to a regular menstrual cycle, especially if it's one on each side. If we have 20 all of a sudden on one ovary, that's 20 times the size of that ovary versus a regular cycle. So that's where your physician or your provider should be able to give you a little bit more individualized counseling.
Does the egg retriever alter the cycle length, or people can
Great question. Yeah. People are like, well, my app thinks this. And I'm like, well, usually, so we give you what's called a trigger shot, and that is timed right before the egg retrieval at a very specific time. The trigger shot will make you get a period. Depending on the type of trigger shot used, that's anywhere usually between 7 and 14 days. So you will get a period. Usually when the period comes, your hormones have completely reset, ovaries pretty much back to normal size. So at that point, I would say most people are pretty much fully cleared to move forward. Thereafter, once you get that induced period from all the medication we've given you, I haven't had patients that say that their cycles get wildly thrown off. So it should return to normal.
Okay. And then the last phase is embryo transfer.
Yes.
Will your recommendation differ between fresh and frozen? How should one approach movement? And again, recovery window. What's all of that?
So a fresh embryo transfer usually follows within a few days after the egg retrieval. So for most patients, their ovaries are pretty still enlarged. This is very different than in a frozen embryo transfer, where a lot of times your ovaries, we intentionally suppress them and shut them down and give you your own hormones. So if you're doing a fresh embryo transfer cycle, I will say be very, cautious with your movement between egg retrieval, between embryo transfer, because your ovaries are still large. Regardless if it's fresh or frozen, I feel like the day of the embryo transfer, I would ideally have you just rest. There is no data that says strict bed rest will improve outcomes. However, I do feel like just taking a day of self-care, of activating your parasympathetic nervous system, resting on the couch is for the best. And then slowly return to movement. And movement and exercise in pregnancy are associated with better outcomes for mom and baby. So definitely, once we confirm that pregnancy, I want you back up and moving.
Okay, sounds good.
Yeah.
So we covered IVF. How about IUI? What should we know about? Does it matter whether it's medicated or natural? Are there any exercise guidelines and precautions that you want us to know?
Great questions. And I think for this, if it's a totally natural cycle where we're just using your own ovulation event and doing an IUI thereafter, that's the same as like your regular menstrual cycle when you're trying it home with timed intercourse. So absolutely no restrictions from my end. The day of the IUI procedure, I say you can go back to normal activities. So I don't feel that there's any restrictions there. If we're using a medication like Clomid or Letrozole, which is an oral pill that you take to help grow maybe 1, 2, or 3 follicles, your ovaries are getting a little bit bigger than normal, but still nothing like the size of IVF. So in general, for those patients, I say same thing. I don't feel strongly to have any activity restrictions. I want you to move your body.
Okay.
There's some types of IUI cycles less common, but in certain patients will do similar injections like IVF. So the same type of like hormone injections to intentionally grow several follicles. And in that case, if you have a big response, then I'll have you pull back on certain exercise.
Okay, so a little bit individual there too. Okay.
Yeah.
Okay, so thank you so much for
You're
taking the time to answer
welcome.
these questions. The one thing I really appreciate that all your recommendations actually align so closely with how we build up the IUI, IVF, fertility program. So I think people are going to be very excited to practice.
Yeah.
Now, if somebody wants to know more about you and work with you, what's the best way to reach out?
Oh, I would love to meet you, hear your story. You can call our office. It's HRC in Beverly Hills, or look us up on the website. I'd love to meet you.
Yep. Thank you so much for taking
Thank
the
you,
time.
Marta. It's always a pleasure.